Kenya is set to lose 30.9 billion shillings in the health funding following the US government's decision to suspend donor support globally. In response, the government has allocated 24.9 billion to ensure continued access to essential medical supplies for TB, malaria, and HIV programs. Health Cabinet Secretary Deborah Barasa announced the measures during a high-level health summit, emphasizing the urgency of maintaining critical healthcare services despite the funding setback. Let's get that report from our reporter, Florence Simeo.
Kenya is expected to lose 30.9 billion in health sector funding following United States' decision to freeze global health support under Donald Trump administration. Health Cabinet Secretary Deborah Barasa stated that the funding halt would significantly impact patients with HIV, tuberculosis, and malaria. Barasa warned that the freeze could result in at least 58,000 new HIV infections by 2030 and 23,000 tuberculosis-related deaths, 20,000 of which will be among HIV patients. She further noted that the reduction in funding could lead to approximately 12,000 malaria-related deaths annually. Despite the anticipated challenges, she explained that the government was working on diplomatic solutions to address the funding shortfall. In addition to allocating funds to cover the gap, she said that more resources will be needed for immunization programs and vaccine procurement.
We are engaging diplomatic interventions. On Wednesday, we'll be meeting the U.S. acting ambassador. We also need to allocate 24.9 billion for commodities previously funded by USG and disburse 2 billion allocated and allocate additional 2.5 for vaccines to avert funding freeze.
Barasa also pointed out that other critical programs were at risk, including blood transfusion program, which was set to lose 2.8 billion in global support by March 2025. She added that the immunization sector required 11.6 billion, while support from Gavi and the US government remain uncertain, creating an urgent need for 2 billion disbursement.
Other critical programs are the blood transfusion program, where 2.8 billion World Bank support is ending in March 2025. Immunization and vaccines, 11.6 billion is required. Gavi and USG support again is at risk, and the recommendation will need disbursement of 2 billion immediately.
She further highlighted that the funding freeze would have a widespread consequences, including the possible redundancy of 40,000 PAFA staff. She urged counties to retain healthcare workers and allocate funds to facilitate the transition from donor-funded programs. Additionally, she called for the settlement of outstanding debts, revealing that her ministry owed KEMSA 1.4 billion shillings, while counties had accumulated a debt of 3.5 billion.
So our asks for the counties to retain all healthcare workers for integration, counties to set aside funds to aid transition from the donor-funded programs.
As Kenya navigates these turbulent financial waters, the government remains committed to safeguard its healthcare systems. The coming weeks and months will be crucial in determining how effective Kenya can adapt to these unprecedented challenges. Reporting for Tandao News Outlook at 1, I'm Florence Simeo.